Allow me to welcome you to our 6th annual Interfaith Symposium. Come and enjoy.
Welcome to our 6th annual Interfaith Symposium.
Welcome to our 6th annual Interfaith Symposium.
Welcome to our 6th annual Interfaith Symposium.
And welcome to our 6th annual Interfaith Symposium.
Welcome to the 6th annual ADAPT Interfaith Committee Symposium. This year's theme is Adapting Through COVID-19, Spirituality and Wellness. Again, I say welcome.
Once again, welcome to the 2020 Essex County Interfaith Symposium. My name is Joel Torres. I am the manager of Family Connections ADAPT Coalition. We want to thank you very much for taking time out of your busy schedule to be with us during the next couple of weeks as you learn about very important topics. We know that all of our worlds have changed over the last couple of months due to the COVID-19 pandemic, and a lot of the things that we are doing now is trying to be innovative and trying to support our communities who are suffering during these challenging times. ADAPT is here to work with you through the symposium and through other events and initiatives to make sure that we can move forward together throughout Essex County. Before we begin today's sessions and before we begin the symposium, we wanted to make sure that you knew a little history about the coalition and information from some of our members and from some other folks who started the coalition.
Hello and welcome to the 6th annual Essex County Interfaith Symposium, a collaborative effort between Family Connections ADAPT Coalition, the Essex County Division of Community Health Services, and the Essex County Prosecutor's Office. Thank you very much for taking the time out to join us in what will be informative and timely discussions to help you support families within your communities. My name is Jacques Harishko, and I'm Chief Executive Officer of Family Connections, where hope meets possibility. The vision of Family Connections is a world where no one faces life's challenges alone, where we all have the opportunities, connections, and resources we need to thrive. That is a goal we work towards every single day. Our work includes counseling, skills building, training, and prevention services. We support clients who are struggling with violence in their homes, families fighting poverty, individuals navigating mental illness and substance abuse. Our highly trained staff is committed to excellence, bringing their many skills and big hearts to work every day. As you can see by the efforts of our ADAPT team to bring you such an amazing, fully virtual symposium to outdo last year's event that brought 150 people together from all over Essex County. This year's symposium is titled Adapting Through COVID-19, Spirituality and Wellness, and is available to all faith-based communities and leaders throughout Essex County, New Jersey. It will provide presentations discussing substance abuse prevention, mental health, adverse child experiences, managing grief, and resources available for faith-based communities to improve the overall health and wellness of children and adults within their communities. With the current pandemic taking place throughout our state, country, and Essex County, it's important for us to give members of faith-based communities the resources needed to serve members of the community in this new environment. We have an exciting set of presenters ready to give you the information needed to use these resources effectively. Remember that many local residents turn to a leader within their faith-based community in times of need or to find support, which is something extremely necessary right now due to the current pandemic. Our job today and for the next 3 weeks will be to ensure that you leave each session with tangible resources that can provide immediate support to members of your communities. You are an integral piece to the increased accessibility to substance abuse prevention and improving overall health and wellness throughout Essex County. Once again, thank you very much for joining us, and we hope to continue working with you on the ADAPT Coalition to improve the health and wellness of community members throughout the county.
We are excited to host this year's Faith-Based Symposium in collaboration with ADAPT and our other partners. Even during this public health crisis, it is important that this critical information be shared. Houses of worship have always been a safe haven for those in need of assistance or facing hard times. We know that many parishioners, especially in the minority communities, often look to their religious leaders for spiritual guidance and to help them overcome obstacles. Because of this trust, we want to make sure that you have the information about drug abuse, mental health resources, and other information about programs and services that can be shared with your members. Drug abuse is not a new issue, but COVID-19 has created more grief and loss and sheds more light on those with this dependency. We want to make sure that you have the proper information and resources to direct people when they come to you for help and support. Thank you for all that you do. Working together, we will continue putting Essex County first.
Good morning. I'm Theodore Stevens, the acting Essex County Prosecutor. Those of us in law enforcement have recognized long ago that we could not arrest our way out of the problems caused by drug addiction and drug abuse. That is why we have partnered with ADAPT, the Alcohol and Drug Abuse Prevention Team of Essex County. Only by working together can we begin to reverse a course and reduce drug use and drug addiction here in Essex County. And in course, that would bring down the need for criminal prosecutions based on drug abuse. As I'm sure you are all aware, that this work is even more challenging as we deal with the worldwide pandemic and the unprecedented racial reckoning. Isolation, unemployment, anxiety, and the growing death toll have brought about increased anxieties and pressures on the community at large, but especially those dealing with a drug addiction. Along those lines, the Essex County Prosecutor's Office has continued our Operation Helping Hand, which is a program aimed at getting offenders directly into drug treatment at the time of arrest, as opposed to going into the court system. Now, as we kick off this year's virtual symposium, I particularly want to thank those of you who are working on the front lines. Your work is more important than ever. It is my hope that at the end of this month-long event, you will have new tools and renewed strength to sustain yourselves as faith leaders and community caretakers. Here at the Essex County Prosecutor's Office, we believe in the power of partnerships. Our ongoing pursuit of justice requires the support of others. During this time of uncertainty, it is our prayer that we can be a steady and constant resource, always ready to assist in any way possible, as each of us attempts to successfully manage our responsibilities during these challenging times. In closing, I want you to do several things. 1, think positively, act decisively, and make life better for others. But in doing so, remember that safety is the most important thing right now. Critically important that you wash your hands and always remember to wear your mask. Good luck, and thank you on behalf of the Essex County Prosecutor's Office.
Opportunity to address you at the start of a crucial meeting, the Essex County Interfaith Committee Symposium. And your theme this year is so timely and so necessary for the good of our fellow inhabitants of this county. And that is adapting through COVID, spirituality and wellness. Late last month, I had a personal note from Pope Francis. And Pope Francis mentioned that something I think we all know, that no one emerges from a crisis the same. You either emerge better or you emerge worse. And I think that is the challenge that we're facing at every level of our society. Look, the struggle with addiction has been impacted in a very unique way during this period of trauma for our whole nation, our whole world. Because the isolation that has been the result of COVID touches the addicted person in the heart of her being. Someone observes, and frequently in 12-step programs, that an addicted person by herself is in bad company. And so you gather together today to look for spiritual closeness while maintaining physical distance. Your reflections are absolutely vital and must be shared with those who are struggling with a disease that needs to get us alone in order to kill us. So I thank you for your time together, and I'm happy to lead you in a prayer. And God, source of all being, source of all love, we thank you for the gift of our lives. We thank you for the opportunity to leave this world a better place than we found it. Open the hearts of your daughters and sons who are taking part in this symposium out of love for those on the margins of our society, particularly those who struggle with addiction. Open their eyes to new possibilities, open their minds to new strategies, and open their hearts to a new solidarity. We give you thanks for your constant presence with us, and we ask your help, and we pray. Amen.
Let's begin by hearing from two of our founding members. The first one is Nicole Grace Watson from the Essex County Prosecutor's Office, and the second is Eileen Fishman, Director of the Division of Community Health Services. They will start by answering the questions: what were their original goals by starting this Interfaith Committee, and how have those goals evolved over time?
To create opportunities to provide faith-based leaders with information on substance abuse prevention and treatment they can share with their congregation. The Interfaith Committee has succeeded these goals when we're engaging with the faith-based community and providing resources on substance abuse prevention and treatment. We've created a network of faith-based members, mental health workers, social services providers, law enforcement, and government personnel that have come together to end the cycle of substance abuse and use.
As I recall, we used a model of a program out of Somerset County. It was started so that we could spread the information to more people in a safe and trusted setting. It was believed that faith-based clergy and leadership would be an invaluable resource if armed with the correct information. Each year, the attendance of the symposium grows, and so does the community involvement. So I guess I can say that I am very pleased with our success to date.
Next, let's hear from some of our coalition members. Some members have been with us since the beginning, others have joined us just last year, but all of their work is very important here at ADAPT. The first question is, why did you join the Interfaith Committee? What were you hoping to learn or gain from volunteering?
Well, it's been my pleasure to join the Interfaith Committee. I joined about 2.5 years ago, and it was a natural progression for me. It was an opportunity for me to take all of my learnings, my experience, both from a faith perspective as well as from my academic credentialing and experience, and bring that into the community, to be able to serve the community and to uplift the community, both in prevention and in overall wellness. Through joining the Interfaith Committee, my experience and all that I desired to gain was really to have practical tools and direction to provide to community members regarding resources and outlets for support for them through their challenges in alcohol, drug prevention, treatment, and overall mental health wellness.
Well, in my capacity at the hospital as the co-occurring disorder specialist, it was important to impact the community, to make inroads into the community. ADAP proved to be perfect organization with people who were of like mind for treatment, for education, in the addictions problem that we're having in our community.
I joined the Interfaith Committee to learn about different ways I could help the youth I serve here in the city of East Orange. And I hoped to gain, and I did gain, a wider network with tangible resources that I can use in real time to help benefit the students that I serve here. And it's been a blessing to me and to them.
The next question is, what is one thing you have gained, either professionally or personally, from partnering with Family Connections Adapt Coalition and the Interfaith Committee?
There are a group of people that I have been connected with that is willing to do whatever they can do to help whomever they can help. That was one of the things I liked about, Adapt and the Interfaith Committee, is that any group of people that needed help, they were willing to help.
The one thing that I gained from the Interfaith Steering Committee is the resilience of the faith-based community and the willingness to learn about substance abuse and prevention services.
The one thing that I can say that I have gained is, I would say, more confidence in addressing people and addressing people and talking to people and understanding what the whole gamut of substance use across the board.
One of the primary things that I've gained, and probably the most valuable, is resources. To be able to connect with other people, other collaborations within the community in which we live, and be able to take those resources and collaborations back and use them within my church community.
Certainly professionally, the opportunity to meet with other individuals who are like-minded, who have a vested interest in working within the community, and especially around the area of substance abuse, because we at New Hope actually have a program there that we offer substance abuse counseling, but we're serving majority of adults. This opportunity with ADAPT and the committee allowed us the opportunity to interact with other organizations that were dealing primarily with youth, and some of the activities, resources that were available through this committee were perfect for us. On the personal side, I met a lot of great people, an opportunity to interact with folks that I probably wouldn't have met, but again, like-minded, great people, people who are working hard in the community. And I guess that was probably the thing that intrigued me the most, was people were really working hard around this initiative.
Next, let's find out what is one thing that has resonated with them, either a presenter, a speaker, or a panelist from a previous symposium that they've attended.
The collaboration between representatives in the faith community, social services, mental health, government, and law enforcement. I've gained relationships with a network of professionals who are committed to reducing substance use and abuse in our community.
One thing. Okay, so hearing individuals speak of their transformations, their experiences, how they've overcome obstacles, how ADAPT has come alongside them. For example, last year's symposium featured Pablo Pizarro, hope I'm saying his name right, and his message was really poignant. It really resonated with me because he talked about him going from a bad place to a better place, And now today he's transforming lives. So he went from experiencing some negativity to now making a positive contribution to his family, his church, and his community. He's done a lot of things. He was up in Livingston, I believe it was, in June doing a prayer outside by St. Barnabas Hospital. He also does the backpack program for children in need. And so he didn't let his experiences get him down. He used it to bless others. And so that's one thing that has really resonated with me.
Well, each year we have panel discussion. And each year the panel is set up with different representation. The one I remember the most is one where a Port Authority police officer was among those on the panel. And he explained how he worked with the homeless and those with substance use disorder in Penn Station, and how he got so much back from the help he offered, which he felt might be minimal, but the reward was far greater than he thought his help was. And the story was very touching because he was touched by the whole process, and it really changed him.
I believe it happened in 2018. We had a speaker, Laverne Williams, who spoke on mental wellness. And in her conversation, she emphasized the fact that if you're not well internally, that you have a tendency to get into some of the issues that ADAPT works for, alcoholism, drug abuse, and that if you're not mentally well, you have a tendency to look for options. And those options are alcohol, drugs. And so that has resonated with me, is that we all have to maintain our mental wellness in order to be right in the world.
One symposium that I remember resonated with me really well was, I believe it was the year 2018. There was a presenter. She approached mental health wellness from an artistic capacity, and she integrated art into wellness for families and youth in the city of Newark, if I remember correctly. And having her present kind of expanded my capacity in understanding how we can approach the overall wellness for those in Essex County. And as I mentioned previously, also gave me an additional resource to provide to families and youth.
Now let's find out, what impact does the committee's work have on the faith-based community?
We provide the faith-based community resources, tools, and encourage them to start the conversation on drug and alcohol prevention.
I guess the work that the committee does as a whole, especially with the coalition of resources that comes together. From the county level, we do have some people from the state level that comes to our meetings and come to our gatherings, and the different agencies that come together with their resources.
I believe the impact on the faith-based community is the information that ADAPT brings to them. I believe that just being able to take the information that ADAPT has, information on how to get rid of unused prescriptions, to take that information to the interfaith community and to put the leaflets out on the table, and anyone coming by could pick up a leaflet and find out where they could take their unused prescriptions to avoid any family member or any visitor coming in and finding those unused prescriptions, and use them towards whatever need they needed to use them towards. So ADAPT attacked that problem that was growing in our community, and that information was able to go out to everybody.
Well, I'm hoping that the impact we'll have on the faith-based community is to help them with some understanding of what addictions are, and for people in their churches and in their families giving them a little assistance with how to go about treatment, how to gain treatment, where to send people for the help that they need. Hopefully we're giving them that kind of information.
I think what really benefits the churches to a large degree is the resources and information, not only gained through the symposium, but the year-round initiatives and activities that ADAPT sponsors have been helpful. That's what I've heard from a number of the clergy and other representatives from the churches who have participated, because substance abuse within the church is no surprise any longer. It's been downplayed over the years, but the pastors and church leaders need the help of organizations such as ADAPT to, as I say, get the resources and get the help for their congregation.
And finally, why is their work with ADAPT and the Interfaith Committee meaningful? And why do they continue to volunteer their time and their talents to this very important work?
I enjoy working with a great team of professionals to help those in need in our community.
My work with ADAPT is very meaningful on many levels. Again, because of relationships I've created, networking that I've been able to do, because it's all helped me impact the community I serve. In terms of the faith-based leadership and the symposium we've created, I believe that because I am quite spiritual myself, and I believe deeply that the faith-based leaders are trusted by their congregants, they need to give out the right and best message in most instances. The symposium allows the faith leaders to understand the disease, the service that can be provided, and offer themselves as valued resources so more people can get into recovery or understand how the disease works and affects perhaps their family members, and better guide them to help their friend or loved one into recovery. It's good work and very important work.
It's meaningful because my community is meaningful to me. And I continue to volunteer because I think you can't help your community by sitting on the sideline. So being a part of the help and work that ADAPT is doing, I think you're able to better serve the community by being available and being hands-on.
So my work with ADAPT and the Interfaith Committee is meaningful because it's a testament that God is able to do far more above anything we can ask, think, or imagine. And when we partner with God and with each other, we can have a greater impact and reach to the outer regions. So even though we tend to focus on Essex County, our work also stretches into neighboring counties and neighboring cities and even other states. So our impact isn't just here in our backyard. We impact the world. We impact future generations. And for me to be able to be a part of that is a privilege.
The opportunity to connect with other faith-based leaders, the opportunity to connect with professionals in Essex County and other agencies and resources is integral to my passion. My passion really is to see people live lives unhindered, and when they do encounter challenges, for them to move past those. So bringing the spiritual and biblical context, marrying that with the practical and reality of life, for me is very rewarding, and I find it very fruitful. So I will continue to serve on ADAPT Interfaith Committee as long as my life permits, because I enjoy the work.